good morning, good afternoon, and good evening, and welcome everyone to today's IFA Global Café. My name is Katrina Buzanis. I'm a Director of Policy and Advocacy here at the IFA, and very pleased to be with you this morning from Toronto or wherever you are. So as we all know, our population is aging rapidly, and with this demographic shift comes a unique set of challenges and opportunities. And one of the most promising avenues for addressing these challenges is through the use of digital health technologies. So from wearable devices that monitor different vital signs to telemedicine platforms that connect patients and healthcare providers, technology has the power to enhance the quality of life of older adults. And however, with this potential comes different considerations and responsibilities to ensure that technologies are accessible, user-friendly, and truly beneficial to those who need them most. So today we'll be talking about how digital technologies can be harnessed to support healthy aging, improve health outcomes, and advance delivery of care, but also through kind of strengthening international cooperation. So this Global Cafe is actually the third, which aims to highlight some of the work being done through the SMILE eHealth Consortium, which we'll be talking about, which is a multidisciplinary and international collaboration that aims to develop novel solutions that support aging in place. So here with us today is Dr. Sverre Bergh and Dr. Ted Scott. So Dr. Bergh is a psychiatrist working as a research leader at the Research Center for Age-Related Functional Decline and Disease at Innlandet Hospital Trust in Norway. His fields of research are frailty, dementia, old age psychiatry, genetics, and health service research. And Dr. Bergh is also the coordinator of the SMILE project, which we'll be speaking a little bit more about. We also have on the line today Dr. Ted Scott, who is Vice President of Innovation and Partnerships at Hamilton Health Sciences in Canada. He founded Hamilton Health Sciences Innovation Function and has established HHS as one of the leading Canadian hospitals in the development and responsible use of AI in healthcare. And Dr. Scott has also established the innovation function with an emphasis on developing new care models, empowering patients and providers while leveraging technology to enable more accessible and equitable healthcare. So welcome, Dr. Bergh, and welcome, Dr. Scott. Very pleased to have you on the line with us today. So we'll kind of just jump right in here. So at the Global Cafe, we always like to learn a little bit about you before we jump into kind of the topic. So I'll ask both of you, can you tell us kind of a little bit about yourself and how did you become involved in your respective fields and become interested in digital health? So Dr. Bergh, I'll hand the floor to you first.
Thank you, and thank you for hosting us. And good morning, and good afternoon, and good evening to everyone. As you said, I'm a psychiatrist by training, but I'm working as a researcher. And I've been working with research on dementia mostly, old age psychiatry, but also the broad range of health for elderly people. And in the field of dementia research and dementia care, we do use digital health to kind of follow our patients and to make sure they are secure at home and to try to make their daily life as good as possible. So that's my background with digital health. And then my hospital has a department for research and innovation, and they are really looking into possibilities to improve digital health for the citizens in our region. So through that department, we got funding for a huge project, which we will talk more about, I am quite sure, about digital health, also including other patient groups than dementia, which is my kind of background. So the last 3-4 years, I've been working with digital health in different patient groups and really seen the potential of it.
Great, thank you so much. So I'm sure, yes, we definitely will be diving a little bit more into kind of the specific research that you have ongoing. Dr. Scott, would you also like to kind of share a little bit about your background and how you kind of ended up here?
Absolutely. Thanks so much, Katrina. Good morning, good afternoon, and good evening, everyone. I was very fortunate to begin my career on the front lines of medical imaging in the late 80s. It was a super exciting time because the technology was just exploding in terms of both the imaging modalities, but also in how we were able to create interoperability protocols to share images. So a very narrow focus in digital health, but then over the course of my career, it's expanded quite a bit. Unfortunately, in my naive early part of my career, I just assumed that the rest of the world of healthcare would digitize and become interoperable, just as my initial field had. And that has certainly not turned out to be the case, but it's been such a delight to watch the field expand. And I've sort of followed it along throughout my career. And now, of course, I'm very excited to be leveraging the most exciting and cutting edge techniques and technologies, but most importantly, using them at the point of care to expand capabilities we can offer our patients and our providers to do their work together more effectively.
Yeah, thanks so much. So I want to dive a little bit deeper into, the topic at hand that, because I would love for you both to provide a little bit more of kind of background on exactly what are we talking about when we talk about digital health. And, what is encompassed within digital health, and also with kind of specific reference to some of the work you're doing in remote monitoring technologies. So maybe Dr. Bergh, I'll let you kick things off.
It's a huge field actually, and it's very broad. So it's everything from telemedicine, which you mentioned to begin with, where you have conversations with health personnel through video conferences or digital devices, to monitoring, like I think Ted can talk more about, than monitoring people at home, but also the way you can get knowledge through technology, the way you can use technology, and not to forget artificial intelligence to kind of improve the prediction of diseases, or the treatment, or the diagnostic workup of a patient. So I think we use digital health a lot in our society, and it's also a way for the different healthcare levels in a country to communicate with each other, which Ted talked about in the beginning, but also with the patient. So this is a great way to improve the communication, but also to learn patients more about their own health and disease, and how to treat it in the best way. So it's a huge range of possibilities, and of course we use digital devices in our daily life. Everyone have a smartphone at the moment, and use it to get access to knowledge and to communicate with others. So it's the same kind of technology used, but for a health purpose, not for a daily life.
Yeah, thanks so much. Dr. Scott, maybe I'll hand the floor over to you to add on to that.
Yeah, maybe I'll just add a comment. Many of us may recall what life was like before Google, before we had access to smartphones. And I certainly recall waiting in line at a photocopier to photocopy journal articles and spend half a day doing fairly basic, mundane research. But what is surprising about digital health and digital things in general is how quickly we take for granted some of these advancements. And I think the big thing to reflect upon is just how empowering the digital world we live in has become for consumers. But that power needs to be realized in healthcare as well. So you may recall the day when the power balance for purchasing a car or other important things was very much shifted in the direction of the suppliers. But now with the internet, with Google, with all the things we have in our hands, we have access to information and capabilities that we never had before. And it's fundamentally changed the way we work in society. And so this is the part of the empowerment we hope to see in our patients and our providers, giving them the tools and access to things in a digital context that can fundamentally change the way healthcare is delivered. So whether it's mundane back office digitization, which just makes things cheaper and easier and better, or exciting new advancements at the point of care that give us new information that can help us make better decisions, the prospect of digital is always very exciting to me.
Yeah, I think that's kind of a nice segue into my next question. So I'm wondering if you can elaborate a little bit more on, how do these technologies actually improve life for the patient, improve the delivery of care, but also kind of speaking at that health system level. So, I mean, Dr. Scott, you've touched on a on a few of those things just briefly, but I'm wondering if you can go into a little bit more detail.
Yeah, so similar to the world of teaching and education, healthcare is fundamentally an information business. All of the decisions we make, we hope, are made based on objective data or other observations that we can make. And digital creates the ability for us to access information that we might never have had before. And that goes the same for the patient. So whether it's a remote patient monitoring program that gives us population level insights in terms of how patients restore, recover from various maybe surgical procedures or other things that we do together, the ability to capture that information and make predictions to better understand how patients can participate in the recovering journey back to health. All of this is made possible through these devices and programs that we set up. So that might be chronic disease management for patients with heart failure or COPD, or metabolic diseases like diabetes, or it might be something more aggressive and acute like oncology and recovering from cancer. So the breadth of application for digital is really quite broad, and that's why it's so important to have expertise in all of these areas, just as we do in all forms of medicine.
Yeah, Dr. Bergh, is there anything you wanna add to that?
Yeah, I think one important thing is that it kind of reduces the gap between the healthcare system and the patients, especially in our regions. That varies as a long distance from where people are living to where the hospitals are situated. So you can be situated at home with your disease or recovering from a surgery or a cancer, and you can measure your vital signs at home, and the clinician can sit at the hospital and actually follow your vital signs, and if needed, do what is needed to start treatment or to adapt the medication or to do anything. So it's a great way to also reduce the necessity of traveling to a hospital or to a doctor to be able to understand your disease and your recovery. And I think also that the patients can learn a lot about their own disease. And we noticed that in our project with persons with lung diseases, COPD, that they might feel that they are deteriorating, that their disease are worse one day, and then they can measure the lung function or the heart rate or the temperature, and they can say, oh no, it's not that bad. So then they can more trust also that they are not getting worse and can reduce the need to go to an emergency room or a GP. So that's a lot of things that can be very good.
Yeah, and just to build on that, I mean, it's so important to recognize the ability it gives us to make interventions, to change medication, to address pain, to be able to order tests, to be able to do a lot of the things that required an in-person visit can now be done remotely through the use of these tools. And that's amazing for our patients who now have the ability to stay home, avoid a lot of unnecessary travel. So it's very, very powerful.
Mm-hmm. Yeah, I mean, just to build on that point, I mean, both of you are kind of living in places where, you know, you have more remote areas, you have more urban areas. I mean, can you speak to kind of how this actually improves equity of care with these kind of technologies?
Yeah, in a number of ways. The thing about digital is that it becomes a very objective way to evaluate the quality of care as well. And because access can be very variable in terms of how people can actually, you know, get themselves to an appointment, maybe there are barriers to transportation. We see that in our community quite a bit, actually. Having the advanced tools in their own home with all of the supports needed is a huge barrier, removal of barrier for many patients in terms of equity and access to care, and especially for those in remote regions, as you've noted. But the other thing is that all these interactions now are documented and auditable, so we can actually evaluate how effective are we in terms of accessing and treating and managing the care of these patients that were otherwise ephemeral interactions as patients came into clinic. There's really no record of the interaction other than just what might go into the electronic medical record. So with digital, we have a whole set of new tools that allow us to basically understand what's happening with vulnerable populations.
Mm-hmm. And then we do have a question in the chat from Shmuel, who is a weekly contributor at the IFA's Global Café, which relates to this, and he's asking how can technologies improve care of older adults from more low socioeconomic groups of the population? And so I think this is exactly related. Is there anything kind of specific to those groups that these technologies can support?
It's a very good question, because it has a lot of kind of facets. Because one thing is that to get access to digital health, you might need to have the devices needed, and some of them are maybe given by the hospital or the healthcare, like the blood pressure cuff or the lung function test and so on. But you might need a smartphone or a tablet to be able to operate it, and sometimes that's given by healthcare, sometimes you need to have it by yourself. So and that's the economical part of it is one thing that can actually make that we are making a technology or a healthcare that is not including everyone in society. And another thing that we have seen in our project and the research is that there are groups in society that do not have the knowledge or they don't use digital devices regularly, so they don't have the knowledge needed to operate it. So they would need more training or more supervision from healthcare staff to be able to set up the system and to make it work. So it's very important, but I think they also would benefit from the knowledge that they can gain from it, and not to forget the systematic kind of way of doing it. I mean, if you have a diabetes mellitus, so you will measure your blood sugar with the apparatus, and you will maybe write down the numbers every day, and you will go to the doctor and show the numbers. But here you don't have to write down anything, you just measure it and it goes automatically to the doctor. So that's also a very good pro for everyone.
Yeah, thanks so much. So I want to move into talking a little bit more about the Smile Health Consortium, but also some of the research that both of you are doing and some of the innovations that you're developing. So Dr. Bergh, can you tell us a little bit about what is the Smile Health Consortium, and specifically talking about kind of the multidisciplinary aspect, the international aspect?
Yes, it's a consortium that has partners from Europe and partners from Canada. So it's a Canadian-European consortium, and it's funded by the European Commission and by the Canadian. You need to help me with that.
It's our national health research body. It's called Canada's Institute for Health Research.
Yeah, thank you. Yeah. And we have partners that are both hospitals, research institutions, but also small and medium-sized enterprises. So there are technological partners that are building kind of new digital solutions or applications that can be used in healthcare. And then our health institutions like our hospital and research institutions that are doing the research and evaluation and testing out the solutions in patients. So we have universities from Denmark, Copenhagen. We have hospitals in the area around Copenhagen. We have a small medium enterprise in Denmark called Apinux. We have a Greek company called Tendertech. We have partners in the Netherlands, Smart Homes and St. Louis, which works with dementia patients. And we have a research institute in Norway called Sintef, our hospital in London Hospital Trust, and a tech partner called TellU. And then in Canada, it's McMaster's University, and it's CloudX, the technical partner. And I think this collaboration between technical partners and healthcare and research is very important, because we are trying to make new solutions through innovation, and then we are trying to test out the new innovation. So it's a research and innovation project. And we have 3 different main patient groups: patients with dementia in the Netherlands, as I said, patients with lung disease, COPD in Denmark and Norway, and then said in Canada is post-surgical patients that are followed at home. It's a broad range of patients. It's a huge consortium, and it's multi kind of the field, the background from in the consortium is very broad. It's very important to be able to do what we have done.
Yeah, I'm wondering if you can talk about that exactly. So how important is the multidisciplinary kind of collaboration? Because this is a lot of industries and a lot of disciplines coming together to obviously make these technologies work. So I mean, maybe Dr. Scott, I don't know if you want to chime in to that as well.
Yeah, I think I'd just like to make one important point, which at the center of our research and clinical programs, we have really just 2 people. That is our patients and our providers. And so it's that relationship, that connection that is most important in this model of care. And it's what guides our clinical operation and our research program. So all of the questions that we ask from a research perspective or opportunities we see in the clinical domain are all guided by how we can strengthen that connection between our clinicians and our providers, and our patients, and what their needs are. And so industry is very innovative, always bringing new technologies and opportunities to us, but they really aren't always sure exactly how they should be calibrated or oriented to support that vital connection. And so it's so important that we have multidisciplinary programs like this where we can learn quickly from other jurisdictions in Europe and Canada and elsewhere, so that we know what works, what doesn't work, how to respond to industry's opportunities as they arise, and how best to serve our patients and our providers. I can go into a few examples of the types of research that we're taking on right now, if that's helpful.
Yeah, absolutely. Yeah, I think that was exactly kind of my next question, is if you both could share some, a little bit more tangible examples of what kind of research are we talking about here, and what kind of, innovation are we talking about? So, Dr. Scott, yeah, go ahead, jump right in.
Okay, so one of the first things is the care that we're providing through our post-surgical population is actually a new service. It didn't exist before. And so that means we have to unlock new resources of physicians, nurses, et cetera. And if you're going to do that, that's an investment. So to understand who best to apply those resources to, we need to know which parts of the populations are most vulnerable and need the most resources, which ones probably need less resources. And so we're using artificial intelligence to stratify our patient populations. That is to say, figuring out which portions of the populations need the most care, which ones can maybe have a shorter duration of monitoring, et cetera. So that's the first problem we're working on. The second one is to serve as many patients as possible. We'd like to automate the back office, the more routine tasks as much as possible, so that we can keep the focus on our providers and our patients on the very specific personal things that need to be done. And the more routine tasks can be automated, just as they are in every other aspect of our life. So that automation function, again, we're going to be doing research upon to see how to do that. And the last thing is, we're really excited about advancing into new areas of care. And you might well imagine that if you're diagnosed with cancer, your journey is going to be, anywhere from 6 months to years even. And the constant back and forth between acute care clinics and home can be exhausting and maybe even substantially reduce your quality of life. And so we would like to make it as much as possible to receive that care in the home and not in the hospital or acute care setting. So we think there's a lot of opportunity in the oncological treatment areas, and huge benefits to our organizations as well, as we reduce potentially the amount of patient bedtime and things like that, which are very important from a resource allocation perspective.
Yeah, thank you. Thank you so much. Dr. Bergh, can you also kind of share what are some of the things that you're working on in your research?
Yeah, and my example would also kind of show the multidisciplinarity of the consortium, because we we wanted to make a kind of a chatbot to help people with COPD to begin with, but also other diseases, to try to figure out or to give them the best information about their disease and also social kind of interaction with other people and sleep. And because what we started with, Ted, was that you can Google everything at the moment and you can get a lot of information on the internet, but you need some help maybe to figure out what is the best or the most correct information. And that's also a problem with the ChatGPT and the AI resources, that they provide a lot of information, but do they actually help you to find what is the best and most correct information? And it may also be different from country to country, what is the right information for the patient group. So we would like to build a chatbot that could help people to get access to the right information. So we started out with workshops and invited persons in Canada and Denmark and Norway to come to a focus group where we talked about what would be important for them to have in this kind of chatbot, what kind of topics or domains would be most important for them. And they talked about social interaction or social life. They talked about physical activity, talked about sleep, and it talked about information about their disease, which is COPD. And then we took that back to our tech partners and we asked them, could you start to build a chatbot with these 4 items or domains? And they did that in the very first prototype version. And we took that prototype version back to the users again and asked them, yes, here is the first example of a chatbot. What do you think? And the users, they were very, very nice, and they commented on everything from the content to the layout to the colors to the is it working for me and so on. And then we could take it back again to the tech partners, and we had 3 or 4 loops actually with this user-centered design where the users could help the tech partners to develop a new digital kind of device or solution that could help this patient group. And then in the end, we could take the final version of the chatbot and we could test it for 12 weeks with a group of patients. And that's what we just done now. And we are working on the results. So I don't have the results right now, but it's very important actually to engage the users in the design of the technology, because the technology can do anything, but the tech people would need to be told what is important for the user. And it could be the patients, or it could be the relatives, if it's persons with dementia, or it could be the healthcare staff. There are different user groups in such kind of. So that's one thing we've done in the SMILE project, and kind of highlighting the user centeredness of our project.
Yeah, I think that's an important point, which is, this kind of co-design with the people that are actually the technology is meant to benefit. And, are there any kind of best practice or anything you've learned from that kind of process of, user-centered design, in just how to kind of go about doing that, how to make sure that you're kind of engaging best engaging kind of the people that the technology is going to serve, and making sure it's actually useful for people?
Yeah, so we started about 10 years ago, and we spent a couple of days with a very large group, about 80 people. And it was very powerful because back then it was still pretty early days in this field. And we brought together our institutional leaders, our vendor partners, our patients, and of course, our frontline physicians and nurses and so forth. And it was very powerful to have everyone together for 2 days. Not so much, I mean, obviously we had many insights and we documented a lot of learnings that we're able to apply in the early stages of our work, but also as a guiding coalition to sort of support the work that we had just begun, to give energy to it so that it could be sustained and iterated upon over the next few years. So I think there's lots of dimensions to co-design which maybe go unsaid, which is often just the buy-in that's needed, and being able to point back and say, we engaged several hundred patients, and we acquired their insights to what their thoughts were, and that's why we do it this way. And that's often very reassuring for patients when we're onboarding into our program.
Mm-hmm. Dr. Bergh, did you have anything to kind of add to that? Any kind of
Yeah.
lessons learned or?
Yeah, I think it's very important to actually demonstrate the technology for the persons and ask them for directly feedback, because we were surprised about the level of details they were actually noticing. And it could be the color of a button on the application. It should be red to show it's to shut off, and or so it's everything, and also the way we formulated the information. They could tell us that that information is, if we don't understand it, you have to use other words or the language. So it's everything like that. And we had mostly the same users that we engaged again and again. So they had seen the previous version of the chatbot and they saw the next version, and then they could also comment on if the changes that we have done were as they expected it to be. So I think that's very, very important. And but then of course we are engaging, although it might be hundreds of people, we are not engaging everyone that should use it in the future. So there will be individual needs and individual thoughts about what's the best design of it. And it should also work for different kind of smartphones and yeah, everything.
Yeah, so I want to also ask Dr. Bergh, because you kind of mentioned that you also have, a lot of these technologies for patients with dementia. And in this case, it might actually be more families is my kind of understanding of people that would be the main users. Can you talk a little bit about that work? How does that work in the context of people with dementia, and also how does this kind of co-design process work in that case?
Yeah, that's for persons with dementia, you will probably need to have technology that both the person with dementia and their relatives and or the healthcare staff can use and find useful. And it might be other things that are important for the relatives that are important for the patients themselves. The relatives are very concerned about the safety of the patient with dementia and would like systems to kind of know if they are inside or outside the house, where they are, if they have shut down the stove so it's not a danger of fire and so on. So we used, in our process, we used off-the-shelf technology that was there to kind of help monitoring the daily life of the patient. But the problem that the relatives saw is that different technology that you can buy off the shelf, they usually have different applications on your smartphone or wherever it is. So we built, we call it a dashboard, a way to kind of include information from different sources into the same screen or the same layout on your smartphone. And in that process, we had workshops in the Netherlands where relatives and patients with dementia commented on the layout of the dashboard and what they liked and didn't like and so on. So I think it's definitely possible to include persons with dementia in the design work because they have meanings themselves and could express them, and it's important to know what's important for them. So we should have both patients themselves and their relatives, but it might be different. And we have seen that in our research we've recently done, that persons with dementia and their relatives, they talk about the same topic, but they see it from different angles. It might be that they need different kind of solutions.
Yeah. No, I think, and how, just kind of on that point, how do you balance, do you, when you're doing that kind of work, how do you balance kind of working for, the person with dementia or versus their families? Because I think I could see those being very, very different perspectives and very different needs to kind of balance.
Yeah, and it's also an ethical kind of question, because the relatives maybe would like more information about the life of the person with dementia than the person themselves with dementia would like to share. if we were able to ask them that question, like monitoring where they live, as an example. So I think in our project we have got more information from the relatives than the patients, which in a way is a shame. I would like that we should have more information from the patients themselves. But I see that a lot of the technology in the field of dementia is for the person's relative or healthcare staff. It's not necessarily for the persons with dementia. So
Yeah.
that's an important field to do even more research and innovation in.
Yeah, absolutely. So I am just going to go to the chat. So there's a question from John. John, did you want to unmute and pose your question?
My question relates to individuals who may be trying to use the internet creatively to research some of the, you get various aches and pains and you go looking for what does this mean and what can be done about it. When a person does that, how can you be confident that you've got a reliable website, as opposed to there are some websites that I've tapped into and I can't believe some of the things I'm being told, and probably shouldn't believe what I'm being told, because the web is a great tool, but there's everyone has access to it, and people input their own ideas, which may be way off base. How can you find reliable, trustworthy websites to guide you? Are there any clues to whether this website is reputable? Thank you.
Thanks, Sean. I think, Dr. Bergh, maybe this is something that you were trying to solve with that kind of chat box function. So I'm wondering if you can speak maybe about that work and how that was, how did you make sure that the information going into that chat box was correct?
Yeah, we had several of the doctors in the project that were reading the information and quality checking the information, and that's how we were doing our best to make sure that information in our chatbot was reliable. But it's a very great question, John, and it's very important because I think you can find what you are looking for at the internet. So if you are hoping to find one answer, you can always Google and Google until you find it. But at least in Norway, where I'm living, there are national websites from the government or from the healthcare society that is more reliable than more personal web pages from individuals. But this is a great question and very important. And the internet or the knowledge base is also adding on every day. So what was reliable information yesterday might not be tomorrow, although it's on the national kind of web page, because it has to be updated also on the national secure web pages.
Thank you so much. So we do have another question from Satya. I hope I'm saying your name right. Do you want to unmute and pose your question?
Yes, well, you just touched on it to say that new information is coming every day. Science and technology is moving very rapidly, much faster than how humans adopt it. And the trouble with many of these technology gadgets is they don't get updated. It's one thing to update information, but also the technology has to move with it. And we have to have a process that's always in place, not just once in a while. So what what is the way in which we design this interaction between the progress of technology and the way we build it into the way we provide care for older people?
Dr. Scott, I don't know, maybe you want to take a stab at that one first?
Yeah, thanks for that question. I think it is one of the biggest challenges that we face in healthcare in general is particularly the funders of healthcare systems are quite slow to adapt and evolve with the rapid pace of technology. And you'll even see generational differences in providers as well, with often the earlier adopters outpacing others in terms of the adoption of technology. So it can make for a very confusing situation. So we do have traditional ways to manage, healthcare processes like accreditation, federal regulatory things like CE marks, FDA, and so forth. But they're not necessarily keeping pace. And I think that is really one of the challenges that we need to resolve, along with the research and clinical innovation, is creating a bit more structure to give confidence to our patients and populations that the things that we're doing with them have been, rigorously supported and not just kind of like thrown at the wall and hopefully it sticks and maybe it'll still be there in 5 years. So I don't really have a particular answer, but I think you've identified a key challenge for healthcare.
Dr. Bergh, did you want to add on to that at all?
Yeah, it's I think also in a way it's something that the healthcare would like, that we are a bit behind at the front of the technology, because the front of the technology might have some flaws and what to say, innovation kid diseases. So there might be some you have to kind of work a little bit with the newest technology before it's absolutely safe and there are no bugs and nothing at all. So that's might be therefore that the hospitals or the healthcare are using the kind of second generation, not the first one. But it's I mean also the rapid turnover of technology makes it very costly for healthcare and for the patients and for society, because then we have to always buy new devices, new tablets, new smartphones to keep up with the pace, and that's probably part of the business model for the tech companies, but it can be a disadvantage for us.
So I think, Satya has very kind of rightly identified one of the key challenges to implementation of some of these digital technologies. I'm wondering if you can speak to what are the challenges that you find in actually, putting these into the health system, having these with the users, because I think, it's great to have the research, it's great to have the technology, but I think sometimes, you've rightly kind of identified, Dr. Scott, that sometimes that implementation or even that kind of bureaucracy that comes with that implementation is what's pretty tough. So can both of you maybe elaborate on what are some of those challenges and how do you kind of get around those challenges?
Yeah, I think if I could just outline 3 areas that I think are really important. The first one is getting alignment between the key groups in terms of what the vision, and getting very specific on what the outcomes should be from the program. So what do I mean by that? I mean, if you're a large hospital or community group, having the leadership supporting that work aligned to the nurses, physicians, and others, and the patients that are taking on this work, so that they support it with the appropriate resources and investments. And then once you've said, okay, we want to reduce this particular complication or improve this health outcome by X or Y, it's ensuring that there's appropriate technology infrastructure and the resources behind it. And this is where research is incredibly helpful, because research brings not just the knowledge, but the resources to bear in setting up the appropriate environments for care and ensuring the patients are appropriately supported in their care journeys. As many will know, the healthcare environment itself is often starved of resources, and without their complementary research function, they wouldn't necessarily have the ability to establish new programs in of themselves with the evidence that we need to guide us. So I think in terms of getting things off the ground on a good footing, it's really partnering with research, driving quality through really high grade evidence generation, and keeping the eye on the ball so that we understand that it's going to require many iterations and many cycles, but we will achieve the outcomes that we have set out to achieve. Or maybe we move in a new direction, but the point is we don't just keep doing the same thing that doesn't work anymore. And everyone kind of stays aligned in terms of what the benefits that are realized. I'll just lastly finish by saying in healthcare, there's a really important concept that we use to guide our work, and it came from the Institute for Health Information. Initially, there were 3 parts, but now there are 5 parts, which is a lot, so just bear with me. But this framework helps us understand how to decide what to do. And the first part is we really want to make sure whatever it is we're doing is driving better health outcomes. The second part is we want to make more able for patients to participate in care and improve their experience. The third part, in a similar fashion, is that our providers have better tools and abilities to do their work. So that's the 3 parts. And then we've added a couple parts. One is that health equity component. And that health equity is important because that way we don't leave people behind, particularly vulnerable people. And I think when you take that plus the last part, which is usually the first thing people think about, which is the cost and how we can drive cost containment and better management of costs, you put all that together, it's called the quintuple aim. It's a really nice way to think about what you're doing and how it should result in all of those benefits being realized.
Mm-hmm. Yeah, thank you for that. I think that's paints a really nice picture of all of the different components that are going into this. Dr. Bergh, did you have any thoughts as well on just the implementation? How do you get the technology to the users?
Yeah, and the first and kind of biggest thing is maybe data security, because we would need to make sure that the data collected by the devices in the person's homes actually goes to the right place and are accessed by the right person. So that's the big thing, and how to secure that the data flow is correct and encrypted in the right way and stored in a good way and accessed only by the healthcare person that should access it. So that's the first big issue. And then, as I briefly mentioned earlier, it's about what could be called digital literacy. Are people having the right knowledge to be able to handle the digital devices and the setup? And we had a survey here in Norway, 150 persons were answering a questionnaire that is called READY, and it's a way to kind of classify or to get a number about the digital literacy of the people. And about 10% of our group, and that our group were patients that were receiving home care service in Norway, and about 10% of them were classified as a low digital literacy level. So they would need more support and supervision to set it up and actually getting it running. So that's also a thing, but we also had practical issues in setting up the system in Norway. It's a remote area somewhere, and some places even don't have a 4G or an internet connection, and then you can't have this service at home without a Wi-Fi or a 4G internet connection. But also connecting the devices to the smartphone or the tablet could be a problem for someone, and it could be okay and working from day one, but then if a device all of a sudden is not connected to the application on the smartphone, who should help the person to reconnect it? I see some of you have headphones probably running by Bluetooth, and we all know it could be difficult to reconnect your headphones to the smartphones. So that's even this has a small detail, but it can ruin the service for a person. So that's something you have to have a kind of a help desk or a resource to help the patients reconnect and get going again.
Yeah, absolutely. I think those are all super important points, because I think, if the person can't use it, or they can't, reconnect the headphone, to go with your example, it's, kind of useless, right? So I think these are all kind of, you kind of also need that education and upskilling, it sounds like, to actually have these things, user friendly, and to have them actually kind of achieve the aims that you've set out to. So yeah, go ahead.
Yeah, because there's also one thing that we experienced, and that when you're measuring a lot of vital signs at home, some of the measurements will be above the cutoff that you have set for that vital sign. And what do you do if a person all of a sudden measure too high blood pressure, or seems like I had to have a fever, or the lung function is deteriorating? It could be that the measurement is wrong, but it could also be that the measurement is correct and the person will need help. So there are also an ethical dilemma about measuring too much too often. Then you will all of a sudden have some wrong measurements that you will need to react to in a way.
Yeah. Yeah, no, absolutely. So I think, we're almost to the end of the hour. I just want to ask one quick question around kind of the international component that we talked about, where you're actually able to learn from, there's kind of a crosstalk between Canada and Norway, for example. What has that given you? What kind of lessons have you learned from being able to have that kind of international dialogue, even though you have different health systems, you have, different contexts, different governments, things like that? Yeah, maybe Dr. Bergh, you can take a stab at it.
I was kind of surprised how similar things were in Canada and in Norway in terms of the healthcare system and the patient group and things. But one thing that we learn is that there are different kind of regulations in Canada and in Europe. So if you should take the setup from Canada, which is Cloud DX and McMaster's setup, and take it to Europe, it's a whole process of getting it approved to use it in Norway or in Europe in general. And especially, where should you store your data? It's usually cloud-based on a server, and where should that server be placed in terms of the regulations? So that's maybe the one lesson learned, but there are also differences especially perhaps in how staff are employed in healthcare in Norway and Canada, how long shifts they are working and so on. And that's been a nice lesson to learn, and I think we can learn from each other. And for us at Innlandet Hospital Trust, it's been a huge kind of advantage to work with McMaster and Cloud DX and Hamilton Health Service, because you are far ahead of us in terms of digital health. So that's been a very, very pleasure for us, and we learned a lot from that.
Great. Dr. Scott, did you have anything to add on that?
Yeah, I don't have a lot to add. I mean, I was surprised by how much commonality there were, not just between us and the Nordics in general, but across the many countries that we've collaborated with. But it's very correct that when you get into the details, it's not helpful often, but the specifics, protocols and things that can get in the way can be real barriers to collaboration and adoption. And it just highlights the very challenging, we just have slightly different challenges to navigate, but it makes it hard to mix and match and plug and play, if you will, different solutions.
Yeah, I think, but I think, important that the kind of the lessons are being learned, and it sounds like there's really great international collaboration happening, which seems really exciting to see. So I am just going to take one moment to introduce our next week's speaker and give you both kind of a moment to think about some key takeaway messages for us in the final minutes of our Global Cafe. So thank you, Luana. So next week, please join us for next Friday session, where we're going to be speaking with Dr. Mary Tinetti, who is a Gladys Phillips Crawford Professor of Medicine at York University School of Medicine. And she's going to be talking about identifying health priorities. So please come back and join us for that talk next week. And then Dr. Bergh and Dr. Scott, I'll hand the floor back over to you just for any kind of final key takeaway messages from our conversation today, and any kind of final thoughts from you both. Dr. Bergh, maybe you can start us off.
Yeah, I think that digital health is the future, definitely. So we should be very happy that the possibilities are there to use digital health today and in the future. It's because the pros are much more than the cons. I think it's important to involve the users in the design of the technology, but I also think that the tech companies should be given we should kind of be happy that they are going ahead of us, because their technology is important, and they are developing technology that we can use, and they can't wait for us to ask them to develop it. So we have to kind of be happy for them to be ahead of us.
Mm-hmm. Thank you so much, Dr. Scott. Any final words from you?
Yeah, just briefly, I think to echo some of Dr. Bergh's comments, the future of digital health is very bright. And I think it's so important that we focus on how it can enable that connection between our patients and our providers. And in terms of that, like what success looks like, there are programs where the co-design of the program really starts with the patients and providers. The alignment of the resources between the leadership of the healthcare organizations and our delivery programs is very tight. And then the outcomes are very well defined. And if we do all these things, patients will have much more control and support and decision-making capacity, take ownership of their own health and their future goals for their health. And I think at the end of the day, that's what we all want. We want a sustainable program where we can get the support we need when we need it and achieve the outcomes that we want. And that's all possible with digital, and it holds everyone accountable for their role in that work.
Mm-hmm. Yeah, thank you so much. Those are great parting words to end on. So a huge thank you to you both, Dr. Bergh, Dr. Scott, for being with us today on the Global Cafe, as well as to everyone that joins our Global Cafes every single week, as well as a big thank you to the IFA team that helps to put this on every single week. So we will hopefully see you next Friday, and I wish everyone kind of a really great weekend.